Mr. Turner, for what purpose?
Mr. Speaker, would the gentleman yield for questions?
Gentleman yield for questions?
Yes, sir.
Gentleman yields.
Thank you, Representative Bucy. Like you and I think a lot of our colleagues, I hear a lot about the rising cost of insurance from my constituents. Can you talk a little bit about how Medicaid expansion helps address the healthcare affordability crisis we have in the state who already have insurance?
I think one of the key reasons for why it benefits all of us, we talk a lot about the 1.2 million roughly Texans that would benefit, but I said it would help all of us, and this is why. When we have to pay for uncompensated care at the hospitals, our local taxes go up, and insurance will then pick up the other costs by spreading it on to people that have coverage. So more people with coverage, the more the cost can go down.
So, and I've heard in the past, I'm wondering if you have heard this as well, that for people with health insurance, 1/3 of our premiums basically subsidize the cost of uncompensated care in the state of Texas. Does that sound about right?
That is right. And why this is so important, Representative, is we got 5 million uninsured Texans. This won't solve all of that, but this will solve around 1.2 million working Texans making below the 138% of poverty line. That's roughly $21,000 income for a single person. We're talking about $21,000, people that are working in our community, but they can't afford the health coverage. That's why the Affordable Care Act was passed by Congress with the Medicaid expansion preview to do this right here, to cover working Texans, but they just don't have enough to go get the health insurance.
Absolutely. And it's my understanding that studies I've seen, if we expand Medicaid in the state of Texas, it'll mean over $700 million in annual savings to our state budget, create over 230,000 jobs through the economic multiplier effect, and bring $110 billion of our federal tax dollars back home to Texas. Isn't that right?
That's absolutely correct. This is a money savings across the board. We've talked about by the costs on hospitals, especially rural hospitals, having to do uncompensated care. We talked about how it can lower the cost for all those with insurance. But also, we got to think about the preventative healthcare costs. When you have insurance, and I've had conversations with my colleagues that disagree with this, that will talk about insurance doesn't equal care. But we know that insurance dramatically increases wellness checks and preventative healthcare. So while it doesn't mean 100%, if I have insurance, I am significantly more likely to go. Like from 30% to 70%. In kids, it's from 50% to 80%. We're significantly more likely to go get those wellness checks. We're all working on preventative healthcare and healthy lifestyle this session. This is a way to do that. And I think one more thing that's really imperative here, because we're going to hear people talk about what the costs, that it's a 10% match. Yes, the federal government is going to pay 90%. We pay 10%. And this bill was given a hearing. LBB talked about it. It was a long time ago. We've been fighting this fight for a long time. And when LBB, the last time they did a fiscal note on Medicaid expansion, they said net positive fiscal impact to the state, as well as significant savings in terms of local impact. So it will save all of us money through the many reasons we talked about. But we talk about our property taxes being high, our county taxes being high. This is a silver bullet with helping that. And I know our colleagues across the aisle have talked about lowering taxes. Let's do it right now. We can do it with this vote.
The gentleman's time has expired.
Mr. Speaker,
Ms. Turner, for what purpose?
move to extend the gentleman's time.
Motion made. Have you heard it?
10 minutes, people.
Is there any objection? Chair hears none. So ordered.
Thank you, members. So, Mr. Bucy, my last question, I think what I just heard you say is basically we could invest $1 and get $9 back. Did I hear that correctly?
That's correct. And that $1 will also be covered. When you think about how money, we just heard another layout where it was like, well, this money comes from here, but it gets covered in the supplemental. Well, we are going to lower costs across our budgetary needs at the local level and at the state level by having more people with insurance. So it is $1 up front to get $9 back, but it is a net savings across the board.
Absolutely. So my real last question. So I do hear this argument a lot about Medicaid expansion, and I'm sure we'll hear it this evening, that just because someone has health care coverage, just because someone has insurance, that doesn't mean that they'll get health care. Can you respond to that argument?
Absolutely. When Texas kids have health coverage, 85% of them receive their annual well visit. When Texas kids do not have health coverage, 56%. That's a difference of nearly 151%. When it comes to uninsured adults in Texas, only 34% reported having a primary care doctor to see when they were sick. compared to 79% of adults with health insurance, a jump from 34 to 79. So I agree. Insurance doesn't equal coverage. It doesn't equal wellness checks. Insurance enables wellness checks. And if we can get more, then we would be doing something tonight by passing a truly pro-life amendment right here, a pro-jobs amendment, and a pro-Texas amendment.
Thank you, Mr. Bucy.
Thank you, Mr. Chairman.